or nivolumab alone. Two drugs versus one drug.
Okay.
When we combine two drugs, we have better responses, higher chance of response, and in the trial, when they compare both drugs versus one drug, people that had both drugs lived a little bit longer.
Okay.
So it tends to be more effective,
Okay.
Okay.
with the expense of maybe a higher risk of side effects.
Mm-hmm.
So side effects from this treatment is not the same as chemotherapy.
Okay.
Chemotherapy, people get nausea, fatigue, weakness, and
Hair fallout.
hair fall out, and all this stuff.
Mm-hmm.
This doesn't do any of that.
Mm-hmm.
What it does, it activates your immune system to go after the cancer cells.
Okay.
But when the immune system get more activated, it may also go after normal cells that don't have cancer.
Right.
So it may cause inflammation in the skin, with skin rash, itching, very common.
Mm-hmm.
It may cause inflammation in the gut, and people may have diarrhea. It may go after the lungs and cause inflammation in the lungs. It may go after a gland in the brain called pituitary and cause headaches and hormonal imbalances because the gland produces several hormones.
Mm-hmm.
And there's several of those side effects. May go after the joints and cause joint aches and all those things. But you don't have any rheumatological problem because patients that have lupus, rheumatoid arthritis, they are the ones that tend to have harder time with these medications, but you don't have any of that.
She has a little she has arthritis,
Well, I
but
do
that's
have
not
arthritis.
bad.
But that's
Is it-
not
okay.
rheumatological, it's
Oh,
just
okay.
osteoarthritis.
I see.
Okay.
You know?
Okay.
I hear you.
So
Okay.
this is what I think we need to do.
Okay.
Because this tumor is here, it's a big one, it causes trouble that you have to be in the hospital and have a surgical procedure. And so that's what I think we need to do. We need to, if you want to be aggressive and get this
I
thing,
do.
so the will be both drugs.
Okay.
The chance of having a severe side effect, I would say probably 30%. If you use only one drug, you go down to maybe 10%.
Okay.
So increases the chance.
Okay.
But the overall benefit, if you look at responses, survival, adding the second drug, maybe give you another 10% in chance of response, survival,
Okay.
time to recurrence. So it's
What is the
Survival rate, I guess, if you'd say.
so when you look at the data, very interesting, because when you see the survival curves, the curves go like this and don't do this. They go like this and they kind of have a very long tail. So there's patients that are 5 years out with no evidence of recurrence.
Okay.
So we're probably looking at a chance of maybe, I say, depending on the mutation, if the mutation is present or not, we are looking at maybe a greater than 50% chance of being alive in 5 years with both drugs,
Okay.
which is,
and we'll start this right
it's
away.
a disease that was,
Right.
Right.
How long do you think it's been there? I mean, if this tumor is the size of, like fist or whatever, and is it two tumors, two fist size?
yeah, so I don't know. Whatever I will tell you will be speculation.
Okay.
It's hard to know, The thing is, she had melanoma back in
Yeah.
so many years, right? So,
81.
Oh,
Yeah.
sorry. Excuse me. She got disconnected. They've been calling back, and we're not answering.
You know
so
what?
this is what I want to do. I already sent the orders last week to get the regimen approved.
Okay.
And the regimen is approved.
Good.
So we don't have to wait another week or so because I wanted to get things going.
Hallelujah. Thank you.
So what I want to do is I want to do a PET scan,
Okay.
which is a different type of scan. That's the best scan for melanoma.
Okay.
Do blood work. And tomorrow I want you to come back.
Okay.
And tomorrow you will visit with my PA Anna.
Okay.
And Anna will go over in detail all the potential side effects,
Okay.
toxicities, what to expect, so on and so forth.
Okay.
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 We usually do 3 rounds with both drugs every 3 weeks.
Is it a pill or fluid?
A pill.
It's an infusion.
Okay.
So I'm
Oh, it's
sorry.
an
It is.
infusion.
4 cycles
Okay.
every 3 weeks with both.
Mm-hmm.
And after that, we go into a maintenance phase just
Okay.
with one drug called nivolumab. So
Okay.
it's 4 rounds of nivolumab plus ipilimumab. And after that, we can do every 2 weeks or we can do monthly nivolumab nowadays.
Depending on how it
Depending on how things go.
progressing.
Mhm.
Okay.
So we just repeat that more time. So to start out with both of these drugs, she'll come in how often?
Every 3 weeks.
Every 2
Once
weeks.
every 3 weeks.
Mhm.
Oh,
Once every 3 weeks,
Okay.
and it's an
Sometimes we like patients to come in between just to see how they're doing.
Right,
Make sure they're
okay.
doing okay, especially because she's only 18 years old.
exactly. You
Okay.
So,
I love you even more.
the treatment's once every 3 weeks, and the treatment when she comes in, how long does that take? A couple hours?
Well, it depends on the infusion, but it should maybe a couple of hours.
Okay.
Yeah.
And it's just
We'll be here.
hmm Either here or on the other building, depending
Okay.
on where we are on that day.
Okay.
But you'll be here.
Now, the
Okay.
CAT scan, is that, when do I do that?
That will be done at Piedmont.
Mhm.
We're gonna get it done this week. I don't want to
This week.
delay the treatment until we can get the scan
We're
done.
going over there after we leave you for an MRI.
No,
No?
I'm going over there because Dr. Scott,
An X-ray.
I have to see him this afternoon, take out my stitches.
Mhm.
And they want an X-ray, chest X-ray
Chest
done.
X-ray.
Okay.
So since we're going to be over there, or no, CAT
No.
scan's more.
They got a schedule.
Okay.
Yeah,
So
got it.
they will have
Yeah.
to schedule.
I'm not
Okay.
worried
It's
about
a
that.
very special test.
Okay.
Yes.
So yeah, and the good thing is this medication should not interfere with wound healing or like
Mhm.
chemotherapy would.
Okay.
Right.
Yeah.
And it doesn't affect necessarily wound healing. So we should
Now,
be good.
being that I had X-rays, which I'm fixing to cancel my mammogram,
Mhm. Right.
which is supposed to be next week, and there's no way I can
Right,
have a mammogram, of course, with all
I
this.
wouldn't do it right now because it's gonna cause pain.
Yeah.
New Year's
There's
dealing
no
with
way.
melanoma.
Yeah.
There's no
We're
way.
not doing it.
But would anything have shown up in the breast area with the CAT scan that I had?
Not necessarily.
Not necessarily.
Because the if it's small things,
Okay.
the mammogram would be
Mm.
better.
Oh,
But I wouldn't worry about that. We have
Okay.
something already to
Right.
worry
Mhm.
about.
Right, exactly.
So we shouldn't worry about that. Can I check her lungs?
Please.
And so, doctor, so we know she's got the 2 tumors, I guess, in her chest, and where else is the melanoma? I mean, her lymph nodes are swollen. Are they
Oh,
in her
yeah.
lymph nodes?
That's why I want to get a PET scan.
Okay.
Because that's the best test for us to see where the disease is.
Mhm.
And we'll follow her afterwards with PET scans.
Okay.
So we get one for baseline, and
Okay.
then that's our baseline.
Okay.
And then we'll follow
Okay.
later to see the
I
response.
hear you.
Okay. And what about the 2 lesions on her liver and one on her pancreas?
Well, let's see what the PET scan shows.
Okay.
Okay,
So, and then you'll think,
Now,
I guess,
Dr.
is all
Scott's
that related, or
that's probably the same thing.
okay. Okay.
Yeah.
Breathe in and out. Is it sore?
No, I belched just a minute.
Oh, okay.
Okay.
I thought there was causing anything there. All right, good.
Okay.
So, will this medication? I mean, I know that when we come in tomorrow, the nurse, the
Yeah.
PO, go,
Well-
does it make her nauseous and like stuff? We'll
No,
go over all
that's-
that.
Should not.
Oh, good.
Not
Okay.
a medication that causes.
And
Weight
really-
loss?
Not necessarily.
No. Okay.
So it really depends if you're gonna have side effects from immune system activation.
Okay.
Some patients are very lucky because
Yeah.
you know the drug goes after the cancer
Mm-hmm.
and leaves
Everything
cancer
else
cells
alone.
alone.
Mm-hmm.
You know,
Mm-hmm.
and like I say, maybe between 30 and 40% people may end up with side effects with the both combination.
Mm-hmm.
of the drugs, but
Yeah.
some people do just okay.
Okay.
It's just being aware that there's a possibility of that. I understand.
Next question. I mean, she's getting her stitches out today. I mean, is it okay for her to, like, you know, do a little walking? Like, we can walk around to the mailbox and back. Shouldn't she get some walking exercise in?
Mhm.
Yes. Did you hear that? Yes.
Yeah,
Yeah.
honey, I have no problem with it.
Okay. I just want to make sure.
My body will cooperate.
Right, you gotta move.
Yes, she's got to move. Okay. We can start
Well,
that
you know
today.
what? It's obvious now that we got you in here, we'll make sure all the questions are asked.
Elizabeth, do y'all have any questions?
No, not at this time, thank you.
Okay.
I got a great support system.
Mm, let's see.
So, right now, did you tell me a while ago I'm scheduled to come see you?
Oh.
In here tomorrow?
Yeah, and
Okay.
we'll have you, and then I'm planning to start treatment tomorrow.
okay, yeah, good. Okay, so, and y'all let us know what time should we be in here tomorrow? I'm
Let
sorry.
me check out.
Okay.
they give you the-
Because she does have a 4, if we can come in the morning or something, that would be good. She has a 4 o'clock appointment in the afternoon with Dr. Johnson.
Yeah, we
Okay.
can't, with my primary
We
doctor.
can try to. see
Okay.
if that can-
Because I can't get my blood sugar down.
Yeah, her blood sugar is 187 and she's taken a half a blood
Right,
sugar
so
pill.
this is something important, because
Okay.
we really want this to be, under control.
Yes,
The blood sugar?
Mhm.
Yeah.
absolutely,
Gotta be under control,
yes,
very
yeah.
important.
Mhm.
I'm very anxious to get it under control. The lowest has been, from being in the hospital to now, it's 175, my blood sugar. It's
I mean, it was, they were giving her insulin shots in the hospital. It was 300.
So, I mean, it's progress, but
Yes.
not there yet, right?
No.
So Dr. Johnson,
Yeah.
that's
That's
wants
why
to see
she
you.
needs to attack it, yes.
Right,
with
and,
medication.
and we'll check labs today to make
Okay,
sure
good.
everything is okay
Okay.
before we go ahead and give the treatment tomorrow.
Okay.
Yeah.
Can we see an x-ray of the tumor in her chest?
Well, why don't we do this? Why don't we,
Not now.
see the PET scan images?
Okay.
Let's-
Because that's the best thing
Okay.
to do, to
Right
see.
now, yeah,
Let's do that.
Well, I wanted to see him. You didn't
well,
have
I
to.
know, but he's
Okay.
operating on that.
And then
Let's just
when
wait
will
and
we
see
get
the
those
next
back
one.
in? When?
So probably see her back next week to
Okay.
make sure she's doing okay and all
Okay.
that, and then
Okay.
we should have the PET scan at that
Okay.
point.
Okay.
The brain MRI was good, it was negative.
Which is good. So y'all were looking for lesions? I mean, is
Yeah.
that correct? Okay.
Spread.
Which is good.
So tomorrow when I come and see the nurse and she goes over everything, am I gonna be given anything?
Treatment. You're going to start
I
treatment
am- I
tomorrow.
start my treatment tomorrow.
Yeah.
Unless the sugars is through the roof, right?
Oh, gosh.
Then we're gonna probably talk about that, but I'm hoping that things will be okay.
Okay.
So we'll see.
Well, we see her, Dr. Johnson, at 4 o'clock tomorrow.
Yeah.
That's good. All right, so let's do that.
Okay.
All right.
Okay.
Sounds
So
good.
let me take it to the laboratory so I can
Okay.
get some lab work done.
Okay.
All right.